Welcome back to the MedLink Health Connections podcast. I'm your host, Tangela, and today we're going to be discussing a topic that many parents have questions about: children's vaccines and how they help protect kids from illness. Vaccines play an important role in children's health, and it's natural for parents to want to understand more about them. Joining me today are two of our pediatric providers, Jennifer Rubner and Dr. Elizabeth Reece from our MedLink Banks and MedLink Danielsville offices. They'll walk us through the basics, answer some common questions, and share helpful information for parents making decisions about their child's care. Thank you both so much for joining me today.
Thanks for having us.
So let's kind of start off with some of the basics. Why are vaccines such an important part of children's health?
Well, vaccinations protect our children against serious diseases like measles, whooping cough, polio, tetanus, hepatitis, chickenpox, influenza, and more. They won't protect kids from all minor illnesses, but they can prevent many serious diseases.
Okay. Can you kind of explain how vaccines work in simple terms for parents who may be unfamiliar?
Sure. By presenting through the vaccine parts of the protein that our bodies can recognize of these serious illnesses. That's through an injection that the child gets. Our immune system sees that protein that identifies as the germ that can cause these certain illnesses, and then makes antibodies against them. We aren't born with antibodies that protect us. We have some antibodies that come because of our moms, like they'll give us some antibodies through the placenta, but those are kind of short-lived and they don't last for very long. And so by getting the immunizations on a regular schedule as recommended, we make sure that the babies are protected against those illnesses throughout the course of their lives.
Okay. And you kind of covered some of them before, but what are some of the most important vaccines children should receive in their early years?
So when they come in for their 2, 4, and 6-month checkups, routinely they're getting one is called a DTaP that protects against diphtheria. It's something we really don't see much anymore, but our concern is we might start to see it if we aren't immunizing. If it looks like a horrible sore throat, but also produces a mucus that can actually block the child's airway and can be a cause of them almost suffocating on the secretions that their body is producing. And then there's tetanus. That is, you think of it more like if you cut yourself on a rusty nail, but any infection that can bring that infection into the bloodstream, it protects against that. Pertussis, which is whooping cough, that in adults can cause a cough that lasts over 100 days is kind of the way they used to describe it. But in a baby can cause such respiratory distress that often they have to be hospitalized for supportive care. And these also, there's not really any real treatment for a lot of what we give. Many of these are viral infections, and that's another reason why we recommend getting vaccinated. We protect against polio. Jen and I were just talking about that there's the last person that was on an iron lung for supportive care for polio just recently passed away. And we really don't want to ever see that come back again as we go through. That was considered gone in the United States, but we hope that it stays that way. And then also protect against a bacteria that can cause meningitis in babies, and then a different kind of bacteria called pneumococcus that can cause pneumonia and meningitis in babies. So all not super common infections, but again, things that can be devastating, causing children to be either hospitalized and in some cases even pass away because of these illnesses.
And also the rotavirus is given at 2 and 4 months, and that vaccine, that virus used to cause such horrible diarrhea in infants that they would be hospitalized for dehydration, and if the parents didn't recognize the symptoms, could also pass away.
Wow.
And the nice things is that these have been so successful in abolishing a lot of these diseases that I think a lot of times we don't really even think about them because we haven't seen them in so long.
Yeah.
I very rarely see natural chicken pox, which is a good thing. And we sometimes think, why protect against chicken pox? But we always kind of say Jen and I on this side of the fence have unfortunately seen kids in the hospital that have had meningitis or serious secondary skin infections after chickenpox. So a lot of these are to prevent, again, these more serious complications that can occur.
Okay. And how do vaccines kind of help protect not only the child, but also the community?
So that's a term called herd immunity, which is if your baby, say, is a month old and they aren't old enough to get these vaccinations, and you've got older kids, 2 months and above, and they're getting vaccinated for these, the idea is that if they're not carrying those germs, then they won't pass it to a child who's not able to be vaccinated, be it because of their age, that they're just not due for that vaccine yet, or because maybe they have an immune complication where they cannot get those vaccinations. Kids who are undergoing like cancer chemotherapy, certain vaccines they're not allowed to have until they're done with that treatment. So you're trying to protect everybody else by getting your kids protected because there's less of that illness going around.
You're
Okay.
also protecting some of the older adults, which they're no longer have their immunity has waned over time. So if they're a high risk adult with a low immune system, same type of issue with cancer patients or just an older adult, they may not be immune to these vaccines anymore. So you're also protecting them.
Okay. So I'm sure that you guys have many questions asked daily. So many parents do have questions when it comes to vaccines. What are some of the most common concerns you hear in your everyday life?
I think some of the most common is they just feel that the infants are too young to receive that many, that they don't, like Dr. Reece was saying, we don't see these illnesses, so they don't see the need for the vaccine because they don't see the prevalence of the illness ongoing now. They're not thinking that if we stop doing these and have very low vaccine rates, that these illnesses will return quite quickly. That hesitancy is just, I think, a generalized misunderstanding of the vaccines. The misunderstanding, they think that these are new, and that we're doing new things for their children or giving them too many, but really the ones that are tried and true and on the CDC schedule have been around for a very long time. They've gone through multiple peer review processes, they've gone through changes. One of the best examples I can give you for even the measles vaccine, which is a 2-part vaccine. You get one, your first one at 1, and you get your second one on the schedule now at 4 as a booster. And it's a very good vaccine. It gives you about a 98% protective against measles. Well, they found out, and I'm going to age myself here, they found out about 30 years ago when they were only giving the one that the teenage group's immunity waned. And so they started adding that second one. So I got my second measles when I was 15. That was 30 years ago. So people aren't thinking like, oh, this is new. It's only been around for so long. No. They just added a second one to the schedule 30 years ago. That's not even talking about how old the vaccine itself is. So these tried and true, they're not old and new, and they're monitored for safety, and really they're important, and we want to see the kids healthy is why we do them.
The other thing that I think a lot of parents will say, well, that one wasn't around, and like rotavirus wasn't around. I mean, it's been 20 plus years, but we actually give less. When you're thinking about what we present to the immune system, there's actually less now because we used to give what were called whole cell vaccines. So that you gave more to the immune system. There was more chance of getting a fever or more of a reaction to it, as you go through. Now they can take the tiny part from the germ that we want to present to the immune system. And because the science is so good to be able to do that, we can actually cover for more diseases and give less immunogenic, compounds to the immune system. So we actually see less side effects. I would tell you more than more. It's very rare to even see a child get a fever. We instruct the parents to give Tylenol just for comfort because they had to get, injections into their legs, arms. But typically you're not even seeing them get a fever. That's not as common. About 95% of kids don't even get that.
And that's the most common side effects. People are very worried about side effects of vaccines or damaging side effects, and they're not as prevalent as people think. There is a reporting system that you can do if somebody does have a true reaction, but true reactions in vaccines are so rare. It's just not something that you see that puts them in the hospital for having a vaccine reaction as people would think.
Well, okay, so some parents feel overwhelmed by the number of vaccines that children have to receive. What do you say to those who want to delay or spread them out? Or even have concerns about how many it is?
Sure. Well, what I had explained about the whole cell versus the less immunogenic. So really, we're giving less content than we used to, and therefore we have less reaction. The second is that the way that the vaccines are scheduled is really to protect against certain illnesses that will cause harm to the child at that time. We'll take pertussis, for example. So pertussis in an adult is annoying. It's a pesky cough that's going to last for a long time, but it's the babies that are going to suffer, to have respiratory distress and sometimes respiratory failure and have to go in the hospital because of that germ. So you're trying to protect them at the age where they're most vulnerable, and then a booster as they get a little bit older, so that we're keeping that from spreading to other children. Something like rotavirus is not typically given to adults. We're going to give that to kids because of their small body size, that they have a higher chance of becoming dehydrated from the vomiting and diarrhea that goes on. And they do studies that show like that vaccine was actually developed where I went to medical school, and it's caused a 40% reduction in kids that need to be hospitalized for IV fluids. And there wasn't anything we can give to make that virus go away, but it really affects the intestines and causes you vomit and have diarrhea. So if they're losing fluid from both ways, you're going to have to give them something to get that back in. So we'd sometimes have just rooms and rooms and rooms full of kids that were having pooping and vomiting. And that vaccine has really protected a lot of children and saves a hospitalization for many kids. Other ones that you can think of that you would want to protect early, like polio as we go through. I mean, that's something that because we have, immigration population that comes in, sometimes we can, and we still know that we do have wild type polio out there. Most people have just been protected against it as we go through. And so because that is something that can be ingested or can still infect us. That's why we think it's important, and we followed that schedule, for a reason. There were immunologists that studied all of this that said this is the best time to give those vaccines to offer protection to kids.
And I'll add to that, there's no research that supports a delayed schedule. So parents will read books or read other opinions online, but that down to the actual research, the research supports the schedule that we have for a reason, and there's no research at all that supports a delayed schedule.
Okay. So if a child does happen to miss a vaccine, how does that kind of work? Can they catch it up, or?
Typically, the next time that they are in, we can do a catch-up vaccine. There are certain things that after a time you'll age out or get fewer of those vaccines, if depending on how many they missed. But if it's one or two, then yes, they can typically come in and get that done.
So for some parents who are kind of unsure about vaccines, what are some good questions that they can bring to a pediatrician to kind of help them feel more secure in their decision to vaccinate?
I think what I would do is more try to send them to reliable information sources, so that there is a lot of information on the CDC website. There's the sources that we would recommend. The American Academy of Pediatrics has a website called healthychildren.org, and that's got a lot of information about vaccinations. there's called vaccine information sheets. That's what you can pull from the CDC that explains, why are we giving this? What are the possible, side effects of the vaccination? What's the purpose of it as we go through? And then if they want to start there just to get some solid information, I think we worry a lot about the fact that people get a lot of sort of secondhand information, or, somebody's child that they didn't know that had an adverse outcome, but there's no real search into how that happened or if that was indeed due to a vaccination. So there's also a thing that's called, it's temporal in time when something happened when you do it, but it's not causation. So it means if somebody got a vaccination and had some sort of effect, but might not have been due to the vaccination. So that's a hard thing too, that you sort of fight as well, about, vaccinations and safety. I think one of the things I try to tell all parents to sort of say how much we believe in them is that, and I can speak for Jen too, I think, is that all of our kids have been vaccinated, on schedule and got all
Are
the
there any
vaccines
new
that were
vaccines or
recommended. And
updates that
so
parents should be
I
aware
feel
of
like
today?
I try to tell parents, I definitely would
RSV.
not, give my own children these
So
if I didn't think that
it's
they were
kind
safe
of
and
new,
effective.
because
And
the
if I
RSV
had to worry
vaccine,
about them,
we've
I
had
wouldn't want
Synagis
to
around
do
for a long
something to
time,
your
which
kids
is
that I wasn't
a
doing to
very
my kids. So,
specialized
I really
vaccine
feel that they
against
are safe, and I feel
RSV.
very comfortable
But
giving
that
them.
took
And
a
like I
very
said, all my
special
kids were
group to get
immunized
into.
with
You had
the
to have
on schedule.
be born
And
very
so
early, have a
I
heart
think
defect.
there was
We're
just
not asking
so
parents to do
much
anything we haven't done
stipulation to get
ourselves. That vaccine to protect you against RSV. And now we have just the Street by Fortis RSV vaccine for under 8 months during RSV season. And now it's been around for several years now, and it's becoming more readily available. So last year we started to be able to give more of it because we finally were able to get more of it. And really, that one's one that hits a little bit more home, because most parents can think of a kid that or a relative that they're like, oh, they were hospitalized with RSV, or they had to spend, they had to go on oxygen because at the hospital with RSV, or they, were really, really sick with RSV. And so what that vaccine does is it decreases their risk of hospitalization, risk of getting RSV. And so we really saw last year the ability to give it more because of its availability.
Awesome. That's awesome. I know I'd never really heard of that. And then all of a sudden it was like everybody had RSV. Then I did hear about the vaccine, and I do feel like last year there was a lot less cases on my social media and things like that.
Well,
So
it is like we didn't used to be able to test for all of these, and now we have rapid tests that can tell us if we have it. So where we might have
okay.
said you have a respiratory infection, now we can say many times, oh, it's RSV, as we go through. And while we had a suspicion it was RSV, we maybe couldn't tell somebody that that's what it is. So now when they can put a name on it, and now they know, oh, also there's a vaccination that my baby could get to try to prevent against that. Or even they do for pregnant moms as well. They offer that so that antibody has crossed before the baby's born. So there's, like Jen says, I think people kind of hear that one and feel a little bit more okay about it because they've actually seen effects of those illnesses, where the other vaccines are almost like a victim of their own success. They've eradicated those bad illnesses. And so we sort of forget about it because nobody has seen a case of smallpox or, like as we go through in a long time.
And I will say we tracked our patients pretty decently for who got Beyfortus last year when they would come in and have some kind of respiratory infection, and none of my patients that got Beyfortus ever tested positive for RSV or were hospitalized. So it has a pretty, if you could look at their website and their information that they're giving out, it's that vaccine's having a pretty high success rate in keeping kids out of the hospital and from getting RSV.
If you could leave parents with one key message about vaccines, what would it be?
You want me to go, then you go? We'll each give a little blurb. So
okay.
Mine would be, please try to look at scientifically sourced sources to get your information. If you have any questions, feel free to ask us. We are going to tell you that we believe that this is the way to keep your kids from having potentially serious infections that are preventable through vaccinations. All of us are in the same goal of trying to keep your kids healthy. I think that you wouldn't come to a doctor if you didn't think that that was their their aim. That's why we went to school to do this, and that we really are not asking anything differently than we have done for our own children.
Yeah, and I would just say, stress the importance of them. Like Dr. Reece was saying, the vaccines are victim of their own success, because we're not seeing those diseases, but our herd immunity in the community right now is so low that we will start seeing these diseases again. And so a lot of parents are not necessarily very concerned about not getting their kids immunized, and they're not as concerned about their kids even catching the diseases. But that's going to change. And so we're really worried about, those things coming back and coming back pretty violently against the kids, because they haven't seen it in a long time. So just the importance of vaccinating your child to keep them healthy, to prevent these diseases, prevent hospitalizations, prevent having to watch your child be horribly sick at home, miss time off from work. Those are all things that you've got to factor in. You think about how much time you miss just with the flu. Well, what if your kid got measles? That's a lot more time at home and missed work, and unfortunately watching your kid just be miserable. So they are very, very important, and not to dismiss vaccines right away when they're looking at, researching, doing reputable sources, and not necessarily taking, people that you don't know opinions over your doctor, your provider's opinion, who's studied this for years and years and really, knows this and has been in medicine for so long. Really take to heart what they have to say.
Awesome. Well, thank you guys so much for kind of covering this and doing this with me today. I appreciate everything that you guys have said and done for me. So thank you.
Thank you. Thanks for having us. Have a good day.
You too. Thank you for tuning in to the MedLink Health Connections podcast. We hope you found today's episode informative and inspiring. If you enjoyed the show, please subscribe, rate, and leave a review on your favorite podcast platform. Remember, the information shared in this podcast is for educational purposes only and should not replace professional medical advice. Always consult with your healthcare provider for any medical concerns. Stay connected with us on social media and visit our website at medlinkga.org for more resources and updates. Until next time, stay healthy and take care.